Good morning, students, and today we are going to deal with other subtopic is rabies virus. Okay, so already you have a well familiar regarding of this rabies virus, right? So it is a viral diseases and which was caused by the dog. Okay, the transmission of infection is dog, and this rabies virus is going to be transmit and causes acute encephalitis. Okay, so encephalitis means inflammation of the brain. Okay, and mostly this rabies virus is a zoonotic diseases. Okay, it's a disease that is transmitted from the human from animals. Okay, so where it is caused by the virus, so the which was the infected virus, and that is going to be affected to the animals, and from the animals, and it is going to be transmitted to the human body. Okay, and where the structure of the rabies and is going to be situated, and it's going to present a matrix protein and some lipid membrane, glycoprotein presence, and some RNA, genome, helical coil is going to be present, and nucleoprotein, phosphoprotein, and RNA polymerase. Okay, so this is a major structure of the rabies virus. Okay, so coming to the introduction, they are saying that same thing, that so the diseases infected as a domestic and the wild animals. So how it is going to be affected? So from the domestic animals or the wild animals, and so when we are close contact with these kind of the animals, and especially with the saliva, when you are contacting, or through bites or the scratches, and where the infection is going to be transmitted. So mostly the rabies is going to have a deaths in mostly in dogs. Okay, so once symptoms of diseases develop, and where it may leads to the fatal stage only, means so the patient will be leads to the death only. Okay, and so what is the source of infection? So what is the source of infection? So the saliva of the rabid animals, so for example like bat, dog, okay, so etc, this kind of cat. So these are all the sources of infection, and whenever the infection is going to be enters, so the virus is going to be present in the saliva, and before manifestations of the clinical manifestations only, so this virus is going to be exhibit. So that is 3 to 4 days before itself, and where the saliva is going to be infected. Okay, and where so if you are not treating, so with these kind of rabies virus, and it is going to be leads to death only. Okay, so incubation period whenever you are taking, and it will take a 3 to 8 weeks, and for exposure, or if it is a hard bite, and directly it is going to be so effective to our central nervous system, and directly the signal sends to the brain. Okay, so within the shorter incubation only, and where the infection is going to be transmitted. So with rabies virus, and it will travel 1 centimeters per day, it is going to be get the transmission of infection. Okay, so how it is going to be transmit the infection means, see here as how it spreads through the animal bite. So whenever the animal bite, it has happens, and where it is going to be so affected to our central nervous system. Okay, and where the brain is going to be damages. Okay, and what is a common carrier of rabies means the bat, fox, cat, and a skunk. Okay, so these are the main cause, and where the infection is going to be transmitted. And the symptoms of in a human being, you can see that fever, agitation will be there, painful spasms will be there over the bited area, and death within a week, and if you are not taking a proper vaccine against the against this rabies vaccine. Okay, and the treatment whatever you are giving, hospitalization is very very important, and immunoglobulin we have to give injection, and anti-rabies vaccine is given over the process. Okay, and forming at mouth after drinking, and produces spasms in the throat. So if your throat are infected, and the clean the wounded area is a treatment whatever you are going to give. Okay, so what is the pathogenesis is happening means, already we discussed that. So the live virus, it is going to be spread through a first mucous membrane whenever the dogs bites, right? So it is going to be affected over first our peripheral nervous system, and later it is going to be spread to our central nervous system, and our tissues and our cells, everything is going to be damages continuously. Okay, So see here, various systems. Okay, brain infected, and via it's going to be travels. Yes. See first one, what is happening here? The virus enters via the animal bite. Okay, and after that, and where the muzzle is going to be. Second one is what? The muzzle is going to be replicates. Okay, and it is going to be transmitted through the this green color is the peripheral nervous system. Okay, and where it is going to be affect to a central nervous system, ganglion, spinal cord. So after that, it is going to be brain is infected, and where the virus travels from the brain to the nervous system of overall system of the body, like for example eye, kidney, salivary glands, our body full organic damage is going to be there due to the rabies virus. Okay, and signs and symptoms, you have seen that bizarre behavior. So bizarre behavior means stubborn behavior is going to be there, and agitation, and you will have the seizures. Okay, convulsions. Okay, and difficulty in drinking water, and patient will be able to eat solids only. Okay, so you can't able to eat thicky process. Okay, so afraid of water. Okay, so that is called as what? Hydrophobia. Okay, even sight or the sound of water disturbs the patient mental status. Okay, and he can't able to drink the water, but he is having a feel of thirst will be there, and the spasms of the pharynx area. And if you are not taking a vaccine, so within the 1 to 6 days, and the presence of death is going to be occur for the patient. Okay, like for example respiratory arrest and somewhere, so death is only the cause, and if you are not taking vaccine against the rabies. Okay, and some of the systems, headache, fever and sore throat, and nervousness will be there, confusion will be there, and pain or the tingling sensation over the site of bite. Okay, hallucinations. Okay, like for example auditory hallucinations or visual hallucinations. So by seeing something, they will be, so nothing will be there, but they will assume that something is happening there. So hydrophobia, fear of water, and paralysis is going to be there, and coma and death. Okay, so here this is a picture where bite marks you can see the dog bites. So what is the prevention we can make means pre-exposure prophylaxis and the post-exposure prophylaxis. Okay, so for example pre-exposure vaccination we have to give. Okay, so what you have to do means, like for example the people with the occupational and the vocational exposure to rabies, and pre itself you have to give the vaccination, and some of the diagnostic laboratories and vaccine workers, veterinarians, scavengers. Okay, so for these people, so you have to give the vaccine of pre-exposure prophylaxis. Okay, and post-exposure prophylaxis means, and after the person is affected with a wound, okay, bite. Okay, so then you like for example consisting of wound care we have to give, and some rabies immunoglobulin you have to give, and rabies anti-vaccine, rabies vaccine you have to give, and you have the area where the wounded, the bite area is there, you have to cleanse the area, and a chemical treatment and suturing you have to do if it is a deep bite, and anti-rabies serum, and some of the antibiotics and anti-tetanus measures, and some of the observe the animal for the 10 days, and whether the dog is infected with the rabies or not. Okay, that you have to identify. Okay, so what is the precautions you have to take means, so soon after the bite of the dog, so first wash the area of an animal bite thoroughly. Okay, so under running water you have to wash thoroughly, and wash lesions well with the soap, and the water is very very important, and you have to take a tetanus booster dose you have to take, and some immunoglobulins you have to take, and vaccine also you have to so give. Okay, so how you have to provide this vaccine means, so days will be there. For example 0 indicates that the first day of the bite. Okay, and again 3rd you have to come, and 7th and 14th and 28th, like that. So you have to take a 5 times of vaccine you have to induce. Okay, and 2 human rabies immunoglobulins are also available, you have to provide that, and that will be provided in vials, so that is so 150 nanometers in ml you are going to give it. Okay, and wound cleansing and treatment thoroughly we have to give, and initial treatment for animal bite should include through cleansing. Okay, as a physician, and apply pressure if bite is actively bleeding. Okay, so this is a human rabies immunoglobulin structure. So this is a rabies vaccine. Okay, what is the treatment? Already we have exposed that. So clean with the soap and apply alcohol or powder solution, and anti-tetanus vaccine you have to give. And if suturing is there, you have to provide the avoid suturing wounds. Okay, so don't apply any ointments or the cream on the wound or dressing. So just leave it for the air. Okay, antimicrobial like for example amoxicillin, cloxacillin and sulfaxime we have to give, and if any infections are there, and we have to educate for the public for simple local wounds treatment, and only have to give for the contaminated or not used for the procedure of doxing. Because so what is happening here, and still more whenever you are pressing, and still more it is going to be infected. So what you have to do, just wash the area and wash with the soap, and directly consult the doctor to process. And no bandages should be provided to the patient. If heavy bleeding is there, we can stop. Okay, so as per that you should not provide any wound care. Okay, and vaccine administration, how you have to administer, intramuscular schedule, 6 doses schedule you have to give to the patient. Okay, and also intradermal schedules, and you have to give, like for example second day, 0 day, first day. Okay, so like that you have to provide a schedules of the time. See here, vaccination. So day of immunization 0, 1 ml they are giving, and day 3 0.1 ml, and day 7 0.1 ml, and day 28 to 30 0.1 ml they are giving, so to the patient. Okay, and intramuscular also the same. So intramuscular how they are giving, so this is intradermal they are giving, so this is intramuscular, same. Okay, and management of rabies patient. Okay, so medications you have to provide as diazepam, midazolam, haloperidol, and diphenhydramine. So this is the antidepressants you have to give, and supportive care like so suitable emotional and physical support is very very important, and so give an education to avoid the pet, and gentle communication is important, and infection control is also very very important. Okay, so and disposable of dead bodies and in rabies virus is also very very essential. Okay, so that is regarding of an rabies virus and its potential care. Okay, so that is regarding of this rabies virus and the structure. Thank you.